I thank the Honourable Lenora Tambua for her end of the week statement, and I now give the floor to the Minister for Health and Medical Services. You have the floor, sir.
Honourable Speaker, and I would like to respond to the statement. First of all, she has lied. The Nandera Dialysis Center is not gathering dust. It's actually open as we speak, doing a clinic. Shame on you. The person doing the clinic there, look at me, Honourable Member, is an Australian-trained nephrologist. He's an Australian-trained nephrologist. Doing the clinic now, in that place. It is open. Shameful. This is like the tin fish you lied about. This is like the tin fish. Why would you lie to the people of Fiji on camera when it's not gathering dust? It's actually working. Clinics are being done there. Yeah, and don't sing to me. Now, the reason why we made the amendments to the regulations is because we want to make dialysis cheap to every Fijian who can. And honourable member, you must differentiate from acute dialysis from chronic dialysis. Any person who's very sick, and I've had many patients who've been very sick, you would know that. When they come to the hospital and they need dialysis, government pays for it 14 sessions. Pays for the 14 sessions. When they're in intensive care, not a promise, it happens. In intensive care unit. As we speak, there are some receiving dialysis now, today, in the intensive care units in CWM, Lotoka and Labasa. That's paid for by government. That's not reflected on the chronic dialysis. You must demarcate it. Please don't talk about medicine and what's happening in health in Fiji if you don't get it properly. Acute dialysis, which saves many, many lives, are paid for by government. They're paid completely by government. And I've had personally some patients who have needed more than 14 sessions. Some of them have needed 28 sessions, paid for by government. Every day as we speak, there are many receiving dialysis in government institutions, paid for by government, free. Those are what we call acute dialysis. Kidney Foundation of Fiji is different. It is different. And you know that, Honourable Member. Please don't say that that is part of government. That is not. Please don't say that. Kidney Foundation of Fiji runs its own dialysis center. Runs its own. If you look at the numbers around the world, and if you look at small island development states, some of the countries around the Pacific, some of the small island nations, they are putting about 30% of the Ministry of Health budget, 50%, 30 to 50%, just looking after dialysis and the treatment of chronic diseases. Just dialysis alone. There are a lot of people from Tuvalu who are in Fiji at the moment receiving dialysis. When we talk about nephrology care in this country, we are interested in both primary prevention and secondary prevention. We are interested in making sure that we reduce the blood pressure that causes this, that we make sure that we reduce the diabetes that causes this. We want to make sure that we have the ability to be able to test their kidney functions wherever they are. And we have labs all over the country. We've just recently recruited even more lab scientists so that we have lab facilities in some of these institutes, some of these small subdivision hospitals. I talked about the radiology recently. These are being able to have universal health coverage in these places. So I would like to begin by that, Honourable Speaker, and also say that Dr. Ambrose was sent across. He was trained by Fiji government scholarship. He got a master's. I was medical superintendent when we supported him to go for training in Taranaki. This government supported his training. He went to Taranaki with us. He came back and indicated he wanted to go into private. We've sent Dr. Yogeshni. She now works in Lambasa. She's trained in Christchurch. And Dr. Nis, the nephrologist who's Australian trained, who looks after our dialysis center here in Suva. Honourable Speaker, the construction of the center in Nandera is now nearly $800,000. Due to the supply chain challenges that we faced and the fact that the German company that actually sold us this dialysis machine, they indicated to us that they will only allow a biomedical engineer which they certified. So we had to wait. When we finally be able to bring across a biomedical engineer through Fiji Airways into the country, served quarantine, and as we speak again, that place is open. You can go after this, go and check. He is there installing the machines. Is there installing the machine? No, no, I'm not talking to you, Honorable Prasad. Stop bringing lies into this August House. There are 15 dialysis machines which arrived in April. 10 machines are now at that center, and the others we've distributed because we want to be able to support our ICU facilities for COVID-19. So they are in Suba, Lotoka, and Labasa, and they are looking after patients on a daily basis. The state-of-the-art hemodialysis machine made by the German company Freshness will greatly improve the quality of care currently provided to end-stage kidney disease. Once commissioned into service, the machine will add to the number of dialysis machines that will be accessible to kidney disease. Kidney dialysis in Fiji, now we're talking about when those actually, so Honorable Member, you have to understand that we've gone away from people just falling into end-stage renal disease. We now have capable doctors available both in the public system, in Suva and Lotoka, and teams under them, including Dr. Ambrose in private, who are now able to rescue them in chronic renal failure. In the ideal setting, we don't want them to have dialysis. And if the Honorable Member, Honorable Speaker, doesn't know that to have dialysis, you just don't take the dialysis and stick them into somebody's body. They need an operation to create an arteriovenous fistula. Guess who does it? The public system does it. The public system does it. Our surgeons trained locally and in Australia and New Zealand, they do it. They do it. Because you're talking about what's the investment. There's been a lot of investment, Honorable Member. There's been a lot of investment. And these are people that government has supported for their training. So you have the Kidney Foundation, who charges $250. The Kidney Hub, Dr. Amrish, $200. Biomedical Center, Dr. Durusami, $200. Pacifica Care, $200. Northern Dialysis, $150. Honorable Speaker, we fully subsidize those 15 to 20 Fijians in Labasa. The one in Suva, once it's open, we will begin there at $150, and the subsidy kicks in. We're also in negotiations with dialysis center in the West. There's one who's willing to come to us, but what we don't want, and this is what we've heard before, is that they will then add on to their cost. We want them to actually bring down their cost. We don't want a provider to actually say, look, if you're going to give $75 dialysis subsidy, we're going to make the amount now $275. And that's something that one of the providers had indicated to us, that they want to up a little bit their price. We don't want that. We want to actually bring it down. And that's the whole nature of the legislation that was put in place. Honorable Member, Honorable Speaker, in Labasa alone, it costs us $9,300 every month just to be able to provide the actual subsidy. We've started registering in the center and registering and making sure that we have actually the right patients who meet under the certain criteria. We've actually registered 19 patients, and we made it very clear that these patients have to go and be seen by our designated nephrologists, and they register them because we want to be sure that the consultant, the specialist in this area, actually agrees and concurs that they need dialysis. Because dialysis is not for everybody. It's not like a Panadol that you just give for everybody. Because it's a treatment that has its effects, that can save a life. It can also have its side effects. Honorable Speaker, the specialist clinics have been now more than 2 months since they've been working there. They are open up on Thursdays and Fridays specifically to see 60 kidney dialysis patients, and quite a large number of them in Andera that have been seen there are managed without the use of dialysis at the moment. We've been able to rescue them. And now doctors and nurses have been able to rescue them. Honorable Speaker, I just want to finish my statement by saying the Honorable Biman Prasad misled Parliament on Monday. He said there was no Panadol and diabetic medications around the country. I have information here from the Director of Fiji Pharmaceutical and Biomedical Services. And in it, he says, listen, Honorable Member, you misled Parliament. I'm correcting you today. I'm correcting you today. We have it available. We have it available. We actually have more than 87% of stock that is needed over a 3-month period available. And I think it's important to understand, the Honorable Speaker, that these types of statements actually have an effect on our people not coming to institutions, not coming to the health center, not coming to the facility. If you just say things like that bluntly, then what happens? Then what happens? Then our people will say, why should I go to the hospital? Honorable Speaker, that's irresponsible statements. Please, and do not mislead Parliament. I thank you, Honorable Speaker.
I thank the Honourable Minister for Health. Honourable members,